Hello, and welcome to our dental learning studio. I'm your hostess, Dr. Marie Huggy. Join me in welcoming today someone who needs no introduction, Dr. Sigmund Poos. Welcome, Dr. Poos.
Thank you, Marie. It's good to be with you today.
Today Dr. Poos and I will be discussing the conservative full crown preparation for the lower first molar.
Yes, Marie. You know, it's all about anticipatory planning. We're going to tell you what we're going to tell you, then tell you what we told you.
Dr. Poos, is there still a place for the conservative complete metal crown preparation?
Oh my goodness, yes, Marie. There remain some indications for the complete cast metal crown. In addition, the newer monolithic zirconium restorations can utilize this preparation. First we shall discuss indications, disadvantages, and armamentarium for the procedure, followed by a step-by-step instruction.
Dr. Poos, you know the old adage that practice makes perfect. Should the student become proficient with the dentoform?
Yes, most certainly, although I prefer to say that practice makes progress. One should spend as much time as necessary gaining confidence with the preparation prior to treating a real patient.
The diagram illustrates, in millimeters, the minimum tooth reduction required.
The indications for this type of restoration include extensive loss of coronal tooth structure, when axial or occlusal contours cannot be corrected with a more conservative restoration, and most endodontically treated posterior teeth.
The preparation has a chamfer margin prepared with a round-ended tapered diamond burr such as the Brasiler 6856 type burr. Correct application of this burr will result in a chamfer width of approximately 1/2 mm with axial walls tapered 3 to 5 degrees on each axial wall. Gross reduction is also performed with this type burr.
The flame-shaped burr is used to provide access to the proximal surfaces of the tooth. After the appropriate access is accomplished, the 6856 is used to refine the proximal chamfer margin.
The K-type burr is used to remove lips from the finish line. Lipping of the finish line is produced when more than 1/2 the burr width engages the axial wall in the chamfer area.
Begin the preparation by using the 6856 to produce depth cuts on the occlusal surface. Depth may then be verified with a periodontal probe. The grooves are then connected. The reduction is performed anatomically, preserving the basic external anatomy of the tooth.
Depth cuts may be evaluated with a periodontal probe or putty reduction guide. About 1.2 mm is desirable. After finishing, overall reduction is approximately 1.5 mm. Slightly less reduction may be placed in the non-functional cusp areas, but the restoration must not be too thin. Some operators advocate slightly more reduction. Assuming retention and resistance form are adequate, slightly more reduction on the order of 1/2 mm is not discouraged. After occlusal reduction, axial depth grooves are placed in the cervical 2/3 of the tooth and are about 1/2 the width of the 6856 burr. Keeping the burr in contact with the tooth and parallel to the long axis, connect the depth grooves. Light pressure and multiple sweeping movements of the burr will produce a smooth uniform surface of correct taper. The preparation is gently lowered to the desired location of the finish line. The chamfer should be less than 1/2 the diameter of the tip of the burr, to prevent lipping. After reduction of the cervical 2/3 of the axial surface, the functional cusp bevel is placed. The burr is held parallel to the opposing cusps, at about a 45-degree angle. Reduction should include space for the buccal groove. The reduction is sufficient to allow room for the restoration in all excursions.
There are no sharp line angles. The lingual is gently rounded. In profile, the external outline form is similar to the buccal and lingual contours of the adjacent teeth. This is accomplished by reducing the tooth anatomically, and preserving the basic outline of the original tooth. This is one reason why preoperative build-up restorations should be to full contour.
The reduction is carried into the embrasure as far as possible without touching the adjacent tooth. Proximal contacts may be reduced with the flame-shaped burr. You will not get a ledge using this burr.
Marie, I want your audience to fully understand that it is very important not to damage the adjacent contact. Several methods are suggested. It is suggested to observe the adjacent tooth and avoid distraction while performing this reduction.
You are so right, Dr. Poos. Obliterating the adjacent contact necessitates some type of reparative treatment. A flame-shaped burr is used to access the contact area. Once sufficient access is established, the axial wall and chamfer are prepared with the 6856 burr. Extreme care is taken to avoid irreparable damage to the adjacent teeth.
The illustration demonstrates use of the flame-shaped burr. After access to the proximal is established, the axial walls are smoothened and chamfer finish line is established. Sufficient reduction is critical, and several methods may be used. Examination of closure in centric and excursions is mandatory. Other methods include a putty reduction guide or red wax.
Ideally, axial wall height is 4 mm with a 3 to 5 degree taper. If this cannot be achieved, retention may be enhanced by lowering the margins and the placement of boxes and grooves.
Lipping should be removed with the K-type burr. The restoration cannot be satisfactorily produced with lipped finish lines.
The preparation should be smooth and all line angles rounded. This is accomplished using stones or a fine finishing diamond. In summary, perform diagnostic procedures required to verify the diagnosis. Beginning with depth cuts, reduce occlusal 1.2 mm. Beginning with depth cuts, reduce axial walls with 0.5 mm chamfer finish line. A 3 to 5 degree taper, per side. Place functional cusp bevel. Round lingual line angle. Remove proximal walls. Continue circumferential chamfer. Verify occlusal clearance. Smoothen preparation, round all sharp line angles. Eliminate undercuts, lipped margins. Ideally there should be 4 mm axial wall height. Dr. Poos will summarize the individual steps.
Using depth cuts, reduce the occlusal surface. The upper image illustrates the orientation of the burr for reduction of the cervical 2/3 of the buccal surface. It is parallel to the long axis of the tooth. The lower image illustrates the orientation of the burr for reduction of the lingual axial wall. The burr is parallel to the long axis of the tooth. For the novice, a graphite line represents placement of the finish line. Reduce the axial walls. The image illustrates the orientation of the burr for reduction of the occlusal 1/3 of the buccal surface. This produces the necessary functional cusp bevel and is parallel to the opposing maxillary cusp. The external outline form of the preparation maintains the original anatomic form and mirrors the adjacent teeth. After reduction of the occlusal, buccal and lingual surfaces, the proximal is accessed with a flame-shaped burr. It is important not to abrade the adjacent tooth. The illustration demonstrates the use of the 169 burr to access the proximal area. This is acceptable, but care must be used to avoid creating a ledge. The proximal surfaces are made accessible to the 6856 type burr for placement of the chamfer finish line. The location of the finish line allows access for a die saw without abrasion of preparation. The preparation is complete. The reduction is verified.
Thank you for joining us today, Dr. Prus, to discuss the conservative full coverage crown preparation. I hope that you can join us again in the future.
It's always a pleasure, Marie. Thank you very much for having me.
This is Dr. Marie Huggy thanking you for joining me and Dr. Sigmund Prus. Please join us in the future. Those interested in fixed prosthodontics may view these videos.